Good morning everyone and welcome back. We found last 2 weeks ago we did a chat with Dr. Anju. We found it very successful and thank you very much for joining in. Please remember that if you want to ask a question, put the question in the chat box. Thank you very much for joining in. And today I've got Dr. Vimbala Lewis. So who is Dr. Vimbala Lewis at DHTC?
Yeah, good morning, Dr. Travis. Thank you for inviting me for this talk and giving me the opportunity to reach out to a larger audience. I'm a homeopathic practitioner here at Dubai Herbal and Treatment Center since the past 6 years. I practice classical homeopathy here, but I also, adapt to the patient needs and I practice different forms of homeopathy.
And why did you choose to become a homeopath originally?
Yeah, it was my passion since my school days to do something in medicine to serve the sick humanity. And I got into homeopathy as a chance. And when I went into the college, I realized that homeopathy also does a very detailed study of medicine, just like medical students. Mm-hmm. It's a 4.5-year course back in India with a 1-year compulsory rotatory internship, which leads to a degree in homeopathy. Sure. So during this course of 4.5 years, I could train in anatomy, physiology, biochemistry, pathology, practice of medicine.
What was your favorite class at university?
The practice of medicine. I like the subject of practice of medicine mainly because we had a very good professor.
It's amazing how that your favorite classes is always when you've got a really good teacher. Yes. Yeah? And I know that you also lectured at some point.
Yeah, the moment I've completed my studies, because we belong to the first batch of homeopathic students back in Mangalore. The college just started in that year when I joined, and they promised us a job because they wanted us to remain there and serve them. So I worked there for 2 years as a tutor in homeopathic materia medica. That is about the practice of medicines, and also in the gynecology department for a short time, for 2 years. Sure. Before I left, and I had to get, and that was the time where I had to settle in life. Right. So then I went and started my own practice in my home.
And how did you arrive at DHTC? I mean, how did you get to start working here?
Yeah, I came to Dubai in 2007. So when I came to Dubai, I immediately contacted some of my friends and I asked them, I want to get into the practice. What is the procedure for the licensing procedure? So it took me about 1 year to prepare for that, and by 2008 December I gave my exams for the Ministry of Health and I cleared my exams, and from 2009 I started practicing in Dubai. And I came to DHTC in 2014 after gaining some experience in Dubai. Right. After practicing nearly 4 years outside, and now since the past 6 years I am practicing in DHTC.
And you've got a successful practice here, which is fantastic. I think what would be nice is to give our listeners a little insight into Dr. Vimbala Lewis. So who are you when you're not at the clinic?
Okay, so when I'm at the clinic, I focus on my patients. I try to give my best as a homeopathic practitioner to the patients. And I see that my patients leave my room with a smile on their face. So that is my motto. But when I go back home, I'm a mother. I have got
How many children do you have?
I have 3 children.
Wow! What are the ages?
My elder daughter is now 25 plus.
25?
Yes.
You certainly look good for your age, Dr. Vimbala.
Thank you for the compliment. Pleasure. That's what my patients also tell me. They ask me, do you take homeopathic medicines? What is your secret?
Well, don't give all your secrets right now because that's going to be a problem. Okay, so you've got a 25-year-old daughter, and what other children do you have?
Yeah, my second daughter is 22 years old, and the youngest one is now 15.
Nice. And I heard you love gardening as well.
Yes, I do, because when I'm at home I want to, get into a different sort of world. So I enjoy the nature, I enjoy seeing the plants, and the flowers growing and all, because I come from a little bit of agricultural family also back at home. So I have seen my grandparents doing agriculture and my parents' interest in gardening. So I think I have that inherited in them.
Fantastic. Yeah. I'm just going to pause for a moment, and if there are any questions that you want to ask directly to Dr. Vimbala, please feel free to do so. So explain to us briefly in simple terms, what is homeopathy? I come from a background where homeopathy was a part of my life growing up, but some people may not know what homeopathy is. So how do you explain homeopathy simply?
Yeah, true. I understand your question perfectly, because people, to be frank, even before I got into homeopathy, even I didn't know what was homeopathy. So homeopathy is a system of alternative medicine which believes in a principle of likes cure likes. And this system of medicine actually originated about 250 years ago in Germany. Dr. Samuel Hahnemann, the founder of homeopathy, was actually an allopathic doctor who was unhappy with the way he was practicing medicine. So he gave up his practice of medicine. He went into translating this pharmacology. So as he was translating one of the books, he chanced upon this theory, and then he developed it further, like the theory of likes cure likes, and he founded the system of medicine.
That's interesting. So how did the Indians come across, because I mean there are lots of great Indian homeopaths.
Yes.
So how, did that sort of transfer from Germany to India, or how did it come to India?
Actually, homeopathy came to India early in the maybe about 200 years ago or 150, to Calcutta first. It was brought into India by German missionaries. In the place where I studied, Mangalore, it was brought in there by Father Augustus Müller, who was a German missionary, who came to Mangalore with a set of medicines. He was practicing this under a tree, where they built, later on it grew into a big hospital, but it was an allopathic hospital. And later on, when the hospital reached 100 years, they wanted to pay tribute to him. So as a result, in 1985, they started this Father Muller's Homeopathic Medical College, which is my alumnus. Yeah, and it is one of the top institutes.
Wow. So why would a patient choose to come and see a homeopath? And why would they choose to come see you?
Okay. Now see, as homeopathy is very popular, especially it's one of the fastest growing alternative system of medicine. It is popular in Europe, it's popular in UK, it's popular maybe in South Africa also. It's popular in South Africa. It's popular in India. So people are grown up with homeopathy. Now in cities like Mumbai, Calcutta, there's not a household who have not taken homeopathy. So one of the reasons is because they have grown up with it and they want to continue the medication. Another reason is they know that homeopathy treats from the root and it eliminates the problems without any side effects. So these are some of the reasons.
That's certainly one of my reasons for going to a homeopath. As a kid, I was very sickly, asthmatic and digestive issues, and tried various forms of allopathic medicine, which only seemed to suppress the symptoms more and therefore create other issues. And there was an old homeopath in Johannesburg. His name was Gekkies. It's a really difficult name, and he would look in your eye and he would look at your complexion, and then he would prescribe the medication. And it was the grossest tasting medicine ever, but it seemed to work really, really well. And since
but
then,
did he give you the liquid medicine?
Yes,
because the pills are very sweet, and it's a favorite of kids actually.
Yes,
they ask for more.
Well, I mean, that was 35 years ago, so I know homeopathy has changed a lot since then.
Yes.
So when a patient consults with you, how would you explain to the audience, how do you go through that process from first consultation?
Okay. So when a patient comes to me and narrates his complaints, I will go into the details of the complaints. For example, he comes to me for chronic migraine. So I go into why and when the complaint started. I may go back into his life space. Suppose 10 years back he has developed the complaint. I go back to 10 years back and I try to study the life space, his reaction to work, his reaction to his family, his reaction to his surroundings, what may be the triggering factor during that time. So it requires a lot of probing into. Of course, it's a very,
so you do a detailed consultation.
Which may extend beyond 30 minutes also.
And I know you have a very specific saying about the detailed conversation. What's that saying that you have?
Yeah, we do a detailed consultation because we say a case well taken is half cured. So this is, by the time the patient leaves my room, he feels he's shared his burdens with someone, he feels much lighter and he feels, okay doctor, I'm already feeling, better. Some of the patients.
And from that consultation, how do you then go and prescribe the homeopathic medication? How do you derive to what to prescribe?
Okay, so once I get all the symptoms, I match it with my homeopathic materia medica, the books of my materia medica. And sometimes I might do a process called repertorization, which is a still advanced process, where I come down to 2-3 remedies and then I come down to one remedy which acts best. It's called constitutional prescribing. But occasionally there are cases where I may need to prescribe 2 or 3 remedies.
Let's go to that constitutional remedy. Explain that further. Some people might not understand that. So what is a constitutional remedy?
Okay, a constitutional remedy is a remedy which will cover up all your symptoms, physically, mentally and emotionally, at least 90 to 80%.
Wow.
So it's a remedy when given to a healthy person will produce the same type of migraine what you might have. So then I give you that medicine according that even the dosage has to be altered, and I give it to you, and this medicinal, this medicine has to overpower your disease. So that's the philosophy of homeopathy, which is called likes treat likes.
So that's the likes treat likes.
Yeah, likes treat likes.
Wow. Okay, and I know that I get to see that we get so many great comments and feedback forms about you. What makes Dr. Vimbala unique as a practitioner?
Okay, I'm very passionate about healing and about my patients. When they come to me, I feel it's my responsibility that they should get better. So putting all my efforts into giving them the best treatment, and also trying to find out, okay, when they come for follow-up, if you're not better, I try to find out another remedy. So till they are better, I don't feel at ease. So maybe that's the reason.
And certainly one of the things that I feel is we've got a beautiful mom here with a great heart that takes care of all of her patients in that way. Yeah?
Well, thank you.
Yeah, fantastic. What would you say are your most frequent cases that you come across? What are those patients that you get to see? Which ones are the ones you like?
Okay. So other than children's issues which come to me very frequently because they know it's very safe and kids take these medicines very easily. So a lot of children cases like digestive, respiratory, allergies are one of the strong points of homeopathic prescribing, where we get very good results with very few doses of medicines. So in adults also I treat the same conditions: hormonal issues, menstrual complaints, anxiety, stress, sleeplessness. So I have good successes with these cases, with anxiety, stress and sleeplessness cases.
Just to pause, please remember to add your questions into the text box so that you can ask direct questions to Dr. Vimbala. Now I know you're doing extra studying, apart from being in a busy practice and having a busy household. What's your extra study that you're doing at the moment?
Okay, so I came to know that in this part of the world there are a lot of skin issues, which need to be treated, and people want to avoid steroid creams and harsh chemicals. So I went into the study. I'm currently studying homeopathic dermatology, which is a fellowship course, postgraduate course.
Sure.
Yeah, which gives me exposure to various skin conditions, how to treat them very effectively with homeopathy.
And I think in this day and age, skin conditions, as you say, are very common.
Yes.
And the common approach is corticosteroids application.
Yes.
But that's not necessarily very successful. So, having a deeper approach makes a lot more sense.
Yeah, because we believe that skin issues occur due to something from within. So healing should begin from within. We should start detoxifying with our medicines, correct the lifestyle factors, correct the dietary factors also, and that correct the emotional factors. So this is what the wonder of the homeopathic medicine. It does everything in a very safe and holistic manner.
And as you're saying, the medicine is tasty now comparative to the old days, yes?
Yeah, it depends. Suppose it's a mother tincture, it might be bitter. Yeah. And suppose it's a pills, which I usually give children the pills, and they are very palatable. In fact, they ask for more.
And I remember there was a saying, and maybe you'll have to correct me, that was it Herring's law of cure?
Yes.
What is that? Explain that a little bit.
Herring's law of cure is the way. It's the response we see. We go for when we give the medicine to the patient. Herring's law of cure states that the disease goes from within outwards. That means from within it should come out. And then only, suppose I'm treating you for migraine, you may notice some rash on your skin, which for me as a homeopath is a very, very good sign. because the disease is thrown outwards from the, another thing is from more important organs to less important organs. We say skin is a, the least important, of course, because of cosmetic reasons it's visible, but it is, less dangerous to see something on the skin rather than something which may affect your heart or your internal organs, which you cannot see. So when I give my medicine, if I see something like thrown out from within outwards, from more important organs to less important organs, from upward to downwards, that is also what I check, especially in skin conditions. I see that the face starts clearing, and then the arms, and then the lower limbs. So that is an indication that my remedy is right, and the dosage is right, the repetition is right. So for that reason, I need to see the regular follow-up should be there.
Right.
Because sometimes I need to give another remedy, sometimes I need to add something to the remedy.
I think that's a very important part of dealing with health. Patients come to see us, and it's a very common expectation is I've got these symptoms and I want to get rid of them as quick as possible.
Yes.
Without actually realizing the process of healing. And what you said is a person will come and say, but now I've got a skin problem. And you say, well, it's good that you've got a skin problem because that means the body is healing.
But of course it should be not that it troubles the patient. It should be a very mild thing which will go off in a few days. So that's only a practitioner can judge whether this is a new symptom or this is something which has to come out as a process of detox.
And I think part of that, which you've mentioned, is the relationship that you develop with your patients. So let's move into that as a question. What would you say are some of your most familiar, most enjoyable moments in dealing with practice?
Yeah, so most important is when sometimes when they get up from the room after the consultation and they tell me I'm feeling much better. So then I know my case taking is successful. Another thing is when they come back to me, and sometimes I myself am amazed how 2-3 doses of the medicine has brought down the anxiety.
Right.
Or sometimes a patient comes to me for chronic 10 years of allergic rhinitis, and it gets better in 3 months. And then that time he mentions to me, I also have this skin complaint, that is also getting better. So then I know holistic treatment, cure is taking place. And there are also cases of in women, when I have been treating them for sinusitis, after 2-3 months they come and tell me I have conceived naturally. So these are all the wonders of this holistic treatment.
I think for me that always amazes me is when the body works the way that God intended.
Yes.
Amazing things happen.
Yes.
And humans get themselves into difficult situations where they don't necessarily offer the body what it requires. So if you had to give maybe 3 or 4 tips, what would be those tips that you would suggest to our audience that they can start today to actually start the process of their health journey? What would you suggest?
Yeah, one thing is give importance to your sleeping habits. Sleep at the right time. Give importance to your eating habits. Try to eat healthy. You should exercise. And as far as possible, try to go in for natural remedies.
Nice. Thank you very much. If there are any questions, we'll take them now.
Yeah, someone has asked, drug homeo medicines interaction is available or no?
Oh, that's a very good question. I'm going to try and clarify it. Are there drug interactions? A person's on allopathic medication and then they take homeopathy. Is there a concern there?
No, because the principles of homeopathy is different than allopathy. The principles of homeopathy is likes treat likes. The principles of allopathy is contraria contraris contrary. So when it acts at a different plane, it will not interfere with the medicine.
So a person can come and see you who's on allopathic medication and you can then work with them?
Yes, of course. We have many cases like this, especially in diabetes or hypertension. We tell them do not stop your medicine because if you suddenly stop, your body is so much used to your allopathic medicine. You may come out in a more aggressive manner. So let your body get used to this homeopathic medicine. You will find the improvement. As you start improving, your physician can taper off the doses.
So is there a chance a person can come off chronic medication?
Yes, if they are on homeopathy for a long time.
Wow, that's very exciting.
Yes.
Are there any further questions? Great. Well, thank you very much for attending with us today. We are hoping to do this every 2 weeks. You'll get to meet with all of our practitioners at this personal level. Please remember, you can follow us, you can subscribe. Please tell your friends and family about us as well. We're here to help you. And as you can see, we are always ready to give you the love that you deserve. Have a wonderful day, and we'll chat soon.
Thank you.